let's talk about making informed decisions in labor. This is extremely important and a skill that every woman should have when walking into the hospital to give birth. My favorite way to explain this is to use the acronym B.R.A.I.N. It's a simple acronym. A lot of childbirth educators, a lot of doulas use it, but it's a really effective tool to make sure you have all the information you need to make the best decisions in birth. So let's talk through it. So there's a lot of decisions medically that often have to be made in labor. Not always. Birth is definitely a physiological event, but sometimes medical decisions need to be made. And you want to make sure you have all the information to make them. So for a common example I'm going to use to walk you through this is the example of introducing Pitocin into your birth. A lot of people know Pitocin, a lot of people have friends or family members who've needed it in their labor, but just to kind of break it down super simply, is Pitocin is a synthetic form of oxytocin, the natural hormone that causes contractions. Pitocin is an IV drip. It's a continuous drip once it starts, typically. And the goal of it is to make contractions harder, stronger, closer together. So let me kind of walk you through an example around how to make a good informed decision around Pitocin. So let's say mom is in labor. Things started spontaneously. She was home. Contractions were 4 minutes apart. She decided to go to the hospital. She gets to the hospital and she's 5 centimeters dilated. Great job, mom. And her contractions, though, are starting to space. And I want to tell you, we see this sometimes. When you enter the hospital, sometimes your adrenaline starts going up and your oxytocin starts going down. Because maybe you're a little nervous. You're in a new environment. You're talking to people. They're asking you questions. So for this example, let's say they were 4 minutes apart at home. She gets to the hospital and now her contractions are 7 or 8 minutes apart. And she's laboring for 3 or 4 hours and the doctor comes in, offers to do another cervical check, does that check, and says, you're still 5 centimeters dilated. I want to introduce Pitocin. What do? So the first thing I want to say is in almost all cases, Pitocin is a non-medical emergency, okay? It is a decision that you have time to make. Most decisions in labor are non-urgent decisions, and typically they cannot introduce Pitocin unless you look good on the monitor and baby looks good on the monitor. So you have time to talk and discuss this. So you want to reference the acronym B.R.A.I.N. So the B stands for benefits. Talk to your doctor, talk to your nurse, ask them, what are the benefits of the intervention that you're suggesting? And the benefits of Pitocin are absolutely, they can, in most cases, make those contractions stronger, harder, and closer together. And to be honest, in order to have a baby in almost every situation, your contractions have to be hard, strong, and close together. So great benefit. Some Pitocin might get you back into that pattern that they're looking for and that your body typically needs. The risks, and of course this is a very important piece of the puzzle. One risk to Pitocin is that baby doesn't tolerate it well, and that your body starts having extremely strong, close together contractions, whereas maybe they're only 1 minute apart, maybe they're only 2 minutes apart, and it's a big jump in intensity. Sometimes our babies struggle to manage contractions in that situation, and sometimes mom starts struggling managing contractions in this situation. Maybe it was a goal of this mom's to avoid an epidural, and now she has these super strong contractions and she's starting to think she might need one. Also, introducing Pitocin brings in more medical interventions. Once Pitocin is running, is put in the IV, then mom has to be continuously monitored. So before that, maybe this person was doing intermittent monitoring and had complete autonomy, could have gotten in the shower. Maybe if the hospital has a tub, was moving around freely. Now this client has to be continuously monitored, okay? So benefits, risks, alternatives. So an alternative is something besides Pitocin. As doulas, as educators, we know lots of alternatives. So, and there are a lot when we're talking about a situation where contractions are spacing out. So the first thing I think about in that scenario is, where is mom mentally? Is she suddenly feeling really nervous? Is she really in her head? Are there a lot of people in the room? Are the lights super bright? What's going on? I want to regulate mom's nervous system. So super simple, might not sound like it makes a big impact, but can make a major impact. I turn the bright lights off, LED candles out, put some soothing music on. If your partner is there, or even a loved one, whoever you've brought with you for support, try to just stay connected to them. Try to limit who's in the room. You're in charge of who's in the room with you. So if you're at a teaching hospital, you can say no residents, no students. You can ask anytime someone comes into the room, is it medically necessity for you to be here? I want you to feel safe in your space. So that's the first thing I'm thinking about when contractions start spacing out. The second is, what positions can we do that can maybe help these contractions come back? Contractions space out for a variety of reasons, but occasionally it's because of baby's positioning. Movement can help bring baby down in the pelvis and can also bring up those oxytocin levels. I always go to a bunch of asymmetrical positions. So what that means is one foot's a little higher than the other, and we're really helping that baby wiggle down. If you have a doula in the room, they're going to be the pros and experts on this and will really help guide you into different positions to help things to progress. And there's a lot of different things I could talk about right now, but know the alternatives. You can even talk to your doctor. Are there other medical alternatives to using Pitocin? Sometimes there are other medications they can use. Sometimes they can actually rupture your water. There are, of course, risks associated with those, but those are alternatives medically. And it's important that you understand them, because the goal is not necessarily to avoid every intervention. The goal is to be making informed decisions, okay? And then I stands for intuition. I think it's really important to check in with yourself. So I always, if I'm a doula in the room, say, hey, we're gonna spend 1 minute in complete silence. I want mom to go inward, maybe talk to her baby for a minute, maybe just check in with herself, and let us know what your intuition says as a mom giving birth right now and what you need. Sometimes I have clients who had written on their birth plan and said, absolutely, I do not want Pitocin. My sister had it, my friend had it, never, never, never. There are no nevers in birth. And then she sits with herself in this moment and says, actually, I think this is the tool I need. We've already done X, Y, and Z positions. I feel really confident about this. I feel like I had a good conversation with my doctor. I want to move forward in this direction. Or the opposite. I don't think this is the tool I need right now for my labor. If that's the case, a good way to frame the conversation with your doctor is to say, not now, maybe later. And to give it a time frame, I always say, let's give it 2 hours to see if change has happened. That gives enough time to really try a few different positions, techniques, change the atmosphere, maybe switch mom's mental state, and then see if there's an impact on her labor. If in 2 hours, the doctor comes back into the room, contractions are kind of still where they were, we're not getting dilation, then maybe at that point, mom feels ready to introduce this medical tool. That was a ton of information. I hope this helps. The most important thing in labor, I really believe this, is that mom has agency, mom is informed the entire time, is treated with respect, and is making good, informed medical decisions.